Welcome to the show. I'm Kathy Ireland. Hundreds of millions of women worldwide suffer from pelvic floor disorders, including urinary incontinence and pelvic organ prolapse. Dr. Elan Ziv, CEO of ConTIPI Medical, joins us today to talk about the upcoming new device for pelvic organ prolapse that women can use in the privacy of their own home. Welcome, Dr. Ziv.
Thank you for inviting me.
Now, what are pelvic floor disorders and how do they affect the women who live with them?
Actually, it's a big set of disorders. It affects about 50%, even more, of the women around the world at all ages.
Wow.
Yeah, it does. And the point here is that two of them are very prevalent. That's the urinary incontinence, which affects about 35 to 40% of the women worldwide, and the pelvic organ prolapse, which affects about 50% of the women. There are other dysfunctions as well, such as fecal incontinence, sexual dysfunctions, chronic pelvic pain, sensory disorders, emptying disorders, and others, but these are less prevalent.
And can you tell us about your non-surgical solutions and how they work?
All our devices follow the same concept. All our devices are very small. They go into the vagina within an applicator, something that looks, in many cases, look like a menstrual tampon applicator. So we developed a device like this, which is called ProVate Device. So again, it's a different kind of applicator, but this is a device which actually this and that are the same by the end of the day.
Oh.
Because what we have is a device that is inserted in very small dimensions by the woman herself. She doesn't have to touch herself. She just inserts the device into the vagina. She just presses the plunger. It becomes a ring, and just following that, the device and the applicator separate, and the applicator goes to the dustbin. The device remains within the vagina for up to 7 days, and by then, or whenever she wants, she just pulls the string, the device shrinks back into tiny dimensions and just slides out of the vagina for disposal. It's always by her, no longer need for the medical practitioner.
When the ProVate device is commercially available in the United States, I think women will react very enthusiastically to it. Women want to be able to manage their prolapse on their own. They want to be empowered and be a self-advocate for their own health, and this is going to enable them to take and manage their prolapse and improve their quality of life on their own terms.
For me, working in a company that develops medical devices is a great mission. We know that most women are not willing to disclose their medical condition. We at ConTIPI allow women to control their medical condition and to choose their own lifestyle with no dependency.
Well, Dr. Ziv, thank you so much for helping to empower millions of women with pelvic organ prolapse live happier, more productive lives without surgery. Thank you very much.
Thank you very much. Thank you for inviting me.
And thank you for watching. I'm Kathy Ireland.